Hello, everyone. How are you? Thank you very much for being here today. Good evening. Thank you for your time. We will start our webinar in just a few minutes. I just want to say some words to you regarding the prize that we have in the end. Dr. Ahmet will mention 3 secret sentences during his presentations. So please take note of it. And in the end of the presentation, I will ask you all to send these 3 sentences together. And the first one to send it in the chat will be the winner, okay? I also have here Dr. Emel from Aditek Turkey to help us on this event. Natalia Nakaishi, also a sales representative here in Aditek, will help us to organize this event. The questions that you may have, please write on the chat. In the end of the event, we will read it to Dr. Yasar, and he will be able to answer you all, okay? Now I give the word to Dr. Ahmet Yasar, and I hope you all have a great event. Thank you very much.
Well, thank you, Eduardo. Thank you very much. I will start my presentation now. And hello, everyone. Okay, just a minute.
Oh, good. Perfect.
Okay. You can see my slides, right?
Yes.
Okay, then I'll start. Okay.
Okay, go ahead. Thank you very much.
Thank you. Hello, everyone. I am Dr. Ahmet Yasar. Today, we're gonna talk about self-ligating braces. I will tell you my personal experiences with self-ligating, and this presentation is powered by Aditek Orthodontics. Let me introduce myself first. I have graduated from Atatürk University, Department of Orthodontics, and then worked in several clinics for 2 years. And right now I am running my own clinic since 2020. So my clinic is located at Bursa, Turkey. It's one of the biggest cities in Turkey, and it is very close to Istanbul. And I really encourage every orthodontist to open his or her own clinic. I think this way you can improve your treatment quality and have more fun with the job you are doing. So, the topics of today's webinars are advantages over conventional braces and aligners, and which cases benefits the most from self-ligating braces, easy ways to overcome handicaps of self-ligating braces, and lastly, we're gonna talk about how to sell self-ligating braces to your patient. So, in this presentation, all cases that you will see is treated with EasyClip, self-ligating system by Aditek. So let's talk about EasyClip for a moment. There is passive and interactive and also a hybrid system. The passive system has night-eye clip with straight tap, so the wire moves freely in the slot. So it is better for low friction, sliding mechanics, and arch development. An interactive system has night-eye clip with curved tap, and from the wire 16 by 22, clips start to interact with the wire and pushing it to the slot. So I would say it is better for rotation control and torque expression. I personally prefer passive systems because low friction, sliding mechanics, and arch developments are the main reason I choose self-ligating systems. There is also a hybrid system, as I mentioned. On this system, anterior braces are interactive and posterior teeth are passive. So there is better torque and rotation control on anterior teeth, while there is good arch development and better sliding mechanics for posterior teeth. So let's talk about Archwire Sequence. The system comes with five pair of thermal cu-niti that has universal shape, and it is wider than standard forms. There is O14 and O18 for leveling and aligning. Then you get 14 by 25, 16 by 25, and 17 by 25 rectangular wires for arch development and torque expression. Most of the time I skip 16 by 25 if the arches develop nicely. And I would say each of these wires should stay in mouth for at least 8 weeks to fully work their potential. After that, you can advance into stainless steel working wire frames for sliding and finishing. It's important to use custom shaped stainless steel for the patients, or you can use most suitable size and shape for the patient's dental arch so that you can retain the arch that you have developed so far. You can use these wires up to 6 months. I mean, stainless steel, you can use it up to 6 months. But I recommend to change it every 4 or 5 months because the wire may get scratched and that could interrupt teeth movements. So it's better to change it once in a while. So before advancing, I would like to say some words about thermal cu-nitis. These wires are almost passive at room temperature, but when you put it into mouth, it becomes active and maintain its universal arch form shape at 35 degrees Celsius. As you can see, this wire can be easily manipulated, so you can engage the wire easily on severe crowding cases. And I really recommend you to try engaging the wire to every bracket slots as much as you can, because these wires are not deformed quickly compared to regular nitis. And they maintain its activeness longer, so don't hesitate to bend these wires, just install all the bracket slots as much as you can.
Doctor?
Yes.
Sorry to interrupt you, but I think we already have our first sentences, right?
I'll get to that. Yes, I will mention it when we came.
Oh, sorry, because I heard it and I thought you
was
on time.
Yes, I will mention it later on, because we're gonna mention it a few times.
Okay, thank you.
Okay. So let's talk about advantages of self-ligating braces. So we will first compare it with conventional braces, and the main difference between conventional and self-ligating braces is obviously the ligation type. In conventional braces, we use elastics or metal ligature that locks and forces the wire into slot, and this causes friction and force loss. Especially elastic ligatures does more friction, so therefore I avoid elastic ligatures as much as possible as they are not that effective. Instead, I use metal ligatures as they create less friction and more effective when I am using conventional braces. But if you tighten metal ligatures too, they also create considerable friction. And they are not practical as elastic ligatures. Also, they might cause some irritation to the patient. On the other hand, self-ligating braces has a clip, so the wire moves more freely in the slot, and this enables low friction. Most importantly, low friction is very important, and easy and consistent ligation. So the low friction is the main advantage over conventional braces. And this low friction causes faster results, better sliding mechanics, anchorage conservation, and arch development, especially when used with universal copper nitis. Therefore, you get less proclination of anterior teeth and less need for extraction according to my experience. Also, you have consistent and secure wire ligation, and especially EasyClip has very good and consistent niti clip in my opinion. And one of the most important subjects are hygiene and comfort in my opinion, especially elastic ligatures tends to accumulate plaque, while metal ligature accumulate less plaque but sometimes causes irritations to the patient. So self-ligating is better for hygiene and comfort. Also, it is very comfortable for the doctor because you have easy and consistent ligation, less chair time, and less appointments. As a result, you give less time for the treatment. And this is a very important factor. So let's look at some scientific researches that compares conventional and self-ligating braces. Dr. Haradin has found less ligation time, less appointment, and less treatment time for self-ligating braces. And Dr. Berger has found low friction and faster teeth movements. And Dr. Burney has claimed that you get more expansion. Therefore, there is less need for expansion appliances like quad helix and W-spring. Also claimed that you need less devices for anchorage control. Okay, let's move on to the aligners. I have compared them on some aspects according to my experience. So let's look into that. You can achieve nice ovoid-shaped arches with both aligners and self-ligating, so I would say arch development is even. And for severe crowdings and extraction cases are very difficult with aligners, as we know. It's difficult to achieve parallel tooth movement with aligners, and they usually require extra mechanics like tats. And you get better rotation control with self-ligating. Rotations are one of the most difficult things to treat with aligners, especially if teeth are small. And you get better torque control with self-ligating. You lose some torque, especially retracting incisors with aligners. Of course, you also lost torque with self-ligating, but it's more significant on aligners. So we need to understand that working mechanics for braces and aligners are different. Aligners mainly produce force by pushing, and for braces, the force is mainly produced by pulling. Therefore, molar mesialization is better with braces and distalization works better with aligners in my experience. And for the deep bite cases are very difficult with aligners because thickness of aligners cause posterior intrusion with bite forces. Most of the time, posterior open bite might occur with aligner treatments. On the other hand, aligners have advantage for treating open bite cases for the same reason. So, as for the patient comfort, aligners causes less irritation. Also, eating and brushing teeth is easier with aligners as they are removable. Although removing aligners for every meal and brushing causes some discomfort, but overall I would say aligners are a bit comfortable than self-ligating braces. And brushing is easier with aligners, so patients can control oral hygiene better. And obviously aesthetics is the main reason people choose aligners. Patient compliance is a big issue for aligners as it is very dependent to patient. So aligners meant to be wear at least 20 hours per day. If patient wears aligner like 15 hours per day, it loses its effectiveness by 40 to 50%, and that is too much in my opinion. So most of the time you will need additional aligners. For long distance patients, aligners have advantage if the case is simple. This is important because if the case is complicated, it requires close attention, of course. You can't treat like an extraction case with aligners for long distance patients. Because patient will be using elastics and other mechanics, and you need to follow if the teeth are tracking the aligners. And for self-ligating, you can see patients every 2-3 months, so it can also be a good option for long-distance patients. And lastly, the cost is an important factor and even can be decisive factor, and aligners are, as we know, usually much more expensive. So which one when? I personally choose aligners for open bite and distalization cases, or patient wants anesthetic treatments. And for the rest, I prefer self-ligating braces, and I feel more safe with self-ligating braces overall. Okay, enough talking. Let's see some cases. I will show you which cases benefits the most from self-ligating braces in my experience. And during these cases, I will give you 3 key sentences, keywords, that will give you the chance to win free EasyClip self-ligating system with Archwire Sequence. So, one of the best features of self-ligating braces is, I think, arch development. I mean widening the arches. So when I see a posterior crossbites like this, first thing that comes to my mind is self-ligating braces. Of course, you should use universal shaped cu-niti to achieve this. Sometimes I use these universal cu-nitis on conventional braces, but it doesn't work effective as self-ligating braces due to the force loss. So this is a 10-month progress. Also here we have class 3 molar relationship on right side. We will need lower molar distalization, so we extracted lower third molars and we just used class 3 elastics, no more than that. After 10 months we almost achieved class 1 relationship. And here is the first keywords, and it is arch development. So it's another case with a narrow arches, and this is a 6 months progress. As you can see, we achieved nice ovoid arch form without protruding the incisors. Of course, on those cases, we are achieving dental expansion, not a skeletal expansion. So bear in mind that case should be suitable for dental expansion. To determine this, you have to look at few things, like posterior teeth torque. If the teeth are tipped lingually, that is better. If not, you might end up with relapse. Also, we should look at buccal alveolar bone thickness. If the bone is thin, we might end up see some gingival recessions and maybe some mobilities. So you can treat severe crowdings with self-ligating braces with minimum mechanics. Just put the wires and you will be okay. This is a 5-month progress. As I mentioned before, you engage thermal cu-niti fully to every teeth here from the start, because the wires are not deformed easily. Maybe if I would have used regular nitis for this case, I might have to bypass some teeth or ligate some of them partially, because niti could deform more easily. And this is another case with a 4-month progress. High vestibular canines can be treated with less effort, as you can see. I also fully engaged the wire from the start in this case. So, low friction gives us better sliding mechanics. That's very important because the teeth can move freely with less force loss. So, cases like polydiastema, as shown here, is a good candidate for self-ligating, as you will be closing lots of spaces. Moving teeth as a group is very effective in self-ligating. Here I am retracting lower incisors with the help of a crimpable hook that placed distal to the lower laterals. And I am using crimpable hooks a lot in self-ligating for retraction. You can also use this on conventional braces, of course, but you should be careful about some anchorage loss because of the friction. But for self-ligating system, wire can slide easily to the distal, so you are safer to use this mechanic. And this is the second keyword, it is sliding mechanics. So in this case, we have class 2 on one side, class 3 on other side. We have deep bite, midline discrepancy, and lots of spaces to be adjusted. So we're gonna use lots of elastic and move teeth around a lot, and this is a good case for self-ligating in my opinion. Same case here, we have bite ramps on interior teeth. Bite ramps are a very important part of the self-ligating systems. Every fixed appliances, I think we should use bite ramps, and I recommend to use bite ramps for every case almost. This way you can achieve effective tooth movement and a good arch form. And if there is deep bites or anterior cross bites, it is better to use anterior bite ramps as shown here. But you have to be careful about upper central proclinations. If the upper centrals are retroclined, you have to correct the angle of incisor first. Otherwise, you will retrocline the incisors more. Or alternatively, you might use posterior bite ramps. So this is another case. Here we have persistent milk tooth. The laterals, there is deep bite, posterior cross bite on right side, and the patient have molar extractions. So this is the first month. We started with anterior bite ramps and posterior light elastics to help with the deep bite. We have extracted the milk teeth to start to close space with stainless steel wire, and this is a 11-month progress as we are closing spaces. So we have created ideal spaces for implants, and posterior crossbite is almost fixed. So this is another case. This is a class 2 extraction case. We have severe crowdings and proclined incisors. We started with, of course, posterior bite ramps and early elastics. So this is a 10-month progress. In extraction cases, you will be doing canine distalization and space closing. So self-ligating braces help in these situations. As you can see, canines becoming class 1 and spaces are closing. Same case here, it's occlusal view. As you can see, we have developed a nice wide arch form. Even though we are closing spaces, case when you need to close spaces like extraction cases, arches are tend to collapse. So mainly because of using full elastic chains, and I don't recommend full elastic chains to close spaces because they might collapse the arch. So self-ligating helps on aspects of retaining arch form even if you use full elastic chains. So this is an adult skeletal class 3 case. Patient didn't want surgery and the profile seemed okay to me, so we decided to go without surgery. As you can see, we have class 3 on one side and class 2 on other side, midline discrepancy, anterior and posterior crossbite. I would say it's relatively a challenging case. This is the occlusal view. We have crowding in upper arch, but there is no crowding in lower arch, only rotations, and even there is some space. This is the second month of treatment. We started with bite ramps, of course, and the early elastics. Early elastics are very effective as teeth can move more freely with thinner wires. Of course, you might have some side effects to deal with, but you may use it to your advantage if you can. Here we have anterior cross bites, but I decided to use posterior bite ramps because I didn't want to retrocline the lower incisors as it is already retroclined. At this case, first goal should be treating the anterior crossbite, obviously, and having crowding on upper arch will help to treat crossbite because we will be protruding the upper incisors. And this is only 6 months progress. We nearly achieved class 1 on both sides and treated the crossbites. Such a quick change is very pleasing for me, and the patient is very happy to get these quick results. And the patient used her elastic very well too, so that helped a lot. And the midlines are almost fixed at this stage. And this is the occlusal view. As you can see, nice arch form achieved. We also used cross elastics to help with the posterior crossbite. This is the lower arch. We also have a slight improvement on profile, I think. And in my opinion, another good use of self-ligating brace is temporomandibular joint disorders. I'll tell you in a moment. This patient came to my clinic with lots of pain. She had ortho treatment before, and after treatment she was having TMG pain and clicking sound. Sometimes when we treat patients, we might cause some TMG disorders. That happens to me too, so we need to care about TMG a lot. She told me that she can't stand the pain, and on these cases I always treat the joint first, TMG first, and achieve stable joints. And so we decided to use TMJ splints for full time. And the third and the last keyword is TMJ disorder. And this is the initial panoramic. As you can see, left condyle shape is not good. After 6 months use of TMG splints for full time, the patient wears it even she is eating food. We stabilized joint and the patient has no pain at all. And she was very pleased for the treatment she had because the pain was gone. But as you can see now, we have a whole new occlusion that doesn't harm condyles. It's the ideal occlusion for the condyles. At this stage, she will accept any treatment that I will offer to her because I gained her trust. From now, we started ortho treatment and we used bite ramps on 6 and 7s to imitate TMG splint effect, because we need to maintain the good position of the condyles and we need to align the teeth around that stable joint position to not have same TMJ problems again. At this time, we need to achieve a good arch form and move the teeth fast so that we can easily process this section of treatment, because at this time patient is not very comfortable. And it is relatively hard for the patient. And in this situation, I find self-ligating braces very useful as we can achieve a good arch form and aligning fast with comfort. And it's a good candidate for TMG disorders. So I'm afraid I can't show the further stages of this treatment as we just started the ortho treatment, so maybe next time I will show you. Okay, we have talked about mostly the good things. Of course, there are some disadvantages of self-ligating braces, but I will show you how to overcome these handicaps, these disadvantages easily as much as I can. So, probably the most encountered problem is rotations and in and out problems, especially in passive systems that I use. Wire is having spaces inside the slot and not fulfilling the slot completely. So sometimes this causes rotations to be remain. But there is a simple solution. I install the second arch wire as shown here to fulfill the slot. Here I used 018 copper niti and 014 niti together. After a month, rotations fixed nicely, and then you can move to the next rectangular wire. Or maybe alternatively, you can choose interactive systems to control rotations better. Same here, I installed the second wire to treat rotations, and for 1 month it seems to be fixed. So another issue that sometimes clip might not be closing, and this is a common issue especially when you move into stainless steel wires, as those wires are very rigid. And in this situation I just use an elastic ligature and the clip will be closed probably next month. As we mentioned before, self-ligating system has low friction and wire can move very easily. So the wire can slide to one side and this might cause maybe unwanted tooth movement and irritation for the patients. So you can use a composite as a stopper or a crimpable stop. Of course, crimpable stops are better and more consistent, but a composite pad will do the job most of the times. So as we mentioned before, in passive systems, the wire is not completely fulfill the slot. So this might cause also a torque expression issue. So if the laterals are positioned palatally, as shown here, it is wise to place lateral braces upside down. This will give you extra 20-degree torque, but unfortunately in this case I forgot to place upside down the lateral bracket, so the torque of the lateral is not good. And when you do forced eruption of palatally positioned impacted canines, root is tend to stay palatal as usual, and you might use lower second premolar brackets for 10-degree extra torque, even though this might not be enough. So if you forget to flip braces like me, you can use torque springs, and these are very effective tools, especially it really helps with the impacted canines as they are hard to treat. And here I recommend you to watch Dr. Chris Chang YouTube videos about torque springs. These videos will explain you the proper use of torque springs. So the last topic, how to sell self-ligating braces to your patients. Let's say you want to implement self-ligating braces to your clinic, and let's talk about it a little. So choosing between aligners first. If I believe the case is appropriate for aligners like open bite, distalization, or patient has lots of prostheses and bridges stuff, or simply just aesthetic reasons, then I will suggest the patient aligners, and if they could pay the cost, of course. And for the rest, as I mentioned before, I prefer self-ligating. So whether choosing aligners or self-ligating, you should simply tell the patient difference in mechanics and make the patient understand your knowledge about these treatment options. Make the patient understand you know these treatment mechanics very well, so patient will understand which one is better choice for himself or herself, and this will help the patients to trust you tremendously. So choosing between conventional braces, to be honest, I would like to treat all my patients with self-ligating braces, although I started to use self-ligating braces more and more every day. I still use conventional braces. So, and I'm not gonna talk advantages over conventional braces as we have talked before. So honestly, for me, the only advantage of conventional braces is the cost. And when I believe if the case is a good candidate for self-ligating, I don't even give conventional braces as a treatment option. I just add extra cost for using self-ligating braces and no more than that. Because the advantage of and the comfort of self-ligating braces are good enough for me. But if you want selling points for self-ligating braces, I would say comfort and treatment time, less need for extraction, and having a broad white smiles are the most important ones. Also make sure the patient understands that we are gonna use a better version of conventional braces, like it's an upgraded one. And then when he or she talks with her friends, they will tell about the self-ligating braces. And I even have some patients that came to my clinic and says, I want self-ligating braces like my friend. And that is an important factor to consider. And lastly, I really recommend to that show your patient results that you treated with self-ligating braces. Most of the times, wild smiles are the good selling points with patient that has buccal black corridors as seen here. Most of the patients don't realize those black corridors when you say to them, and they are like enlightening, and it's very effective. And it's really better to show the patient similar cases. For example, if the patient has polydiastema, show them a polydiastema cases that you treated and etc. So this will help the patient to choose you for the treatment. And that's all I can tell you today. Thank you for listening. Those are my Instagram account and my email. You can contact me from there. Also, if you want to buy Aditek products in Turkey, you can contact with Alper Çakır. At below you can see his phone number, and there will be 10% discount until the end of the month. Now, if you have any question, I will try to answer it. Thank you for the listening.
Thank you very much, Dr. Ahmet. It was a very, very rich content, full of good picks. Thank you very much. I have here 3 questions already.
Okay.
The first one would be, do you charge the treatment monthly or do you already offer a closed treatment?
Yeah, if the patient lives in the same city as I do, I like advancing the patient close, so I almost call them every month. But if he or she comes from a long distance, then 2 months is very enough, and it doesn't affect the overall treatment time that much. You can see the patient 2 months if you want.
Okay. The second is, does your patient come to the office requesting for invisible aligners? How you manage to suggest brackets?
So when they learn the price, most of the time they don't want aligners because they are much more expensive. But generally, if the price is not an issue, and if I believe the case is not appropriate for aligners, I will tell them if we use self-ligating braces, we will have better result and faster results, and you might have some problems with aligners. And vice versa. Honestly, if the patient is, like I said, is appropriate for aligners, I tend to suggest aligners. So I think as an orthodontist, you should have various weapons to treat your patients. It's mandatory to have in your arsenal. So, but if you believe that self-ligating braces will be more beneficial, you will tell the difference and how it will be beneficial, and trust me, patients will understand and move towards to that direction.
Okay, right. The third and last one I have here is it common to make extraction when using self-ligating brackets?
Excuse me, can you say it again?
Yes, if it's common to make extraction.
Yeah, it's less common, most of the time, if the case is borderline, I mean, if you are not sure about extracting, then I'll move towards self-ligating braces as they are treating those borderline cases relatively easily. So you can choose self-ligating to not extract teeth. But also you can, as I showed before, you can treat extraction cases with self-ligating. There is also benefit to that. On extraction cases, as I mentioned, arts are tend to collapse because you are extracting a teeth. You are lowering the total material on the jaw. So you'll need to maintain good arch form, and self-ligating braces helps on those aspects. If you do like unnecessary extractions, patients may end up having a black corridors.
Okay, many people are congratulating you for the presentation. Thank you very much.
I thank you all for listening.
So we have the 3 sentences, right? And
Yes.
once I say now, you can write in the chat, and the first one will be the winner. So 1, 2, 3, now. I think you already have a winner. Naim Izquierdo said art development, sliding mechanics, and TMJ disorder. Is it right, doctor?
Yes, it's right. Congratulations.
Congratulations. You can email us and we will coordinate the shipment of it, okay? Also, for those who asked if the presentation will be recorded, yes, you can email us in the same email that we sent you the link, the Zoom link, and we can answer you with the presentation link, okay? Thank you all for your time. Thank you very much for being here. And I really hope to have you in our next event. Thank you, Emil. Thank you very much, Ahmet, Dr. Ahmet Yasar. It was very, very good.
Thank you so much. Thank you for everyone for listening, for participants, and you, of course. Maybe see you next time.
Of course. Bye-bye. Thank you very much.
Hocam harikaydı.
Teşekkürler vallahi. Teşekkür ederim. Vallahi heyecanlandık biraz ama ilk defa işte yapıyoruz.
Gerçekten yani.
Bir şey söyleyeyim mi? Bu pandemide o kadar çok webinar izledim. Hakikaten bu en faydalısı diyebilirim.
Gerçekten mi? Sağ olun.
Çok güzeldi.
Ya evet, ben böyle daha çok hani klinik olarak nasıl yardımcı olabilirim, nasıl böyle pratik bilgiler verebilirim diye düşündüm. Böyle bir
Çok
şey
güzel
çıktı.
olmuş. Vakalarınız da çok güzel olmuş gerçekten.
Sağ olun.
Bayağı da ciddi vakalar.
Evet ya, ameliyat hastası.
Evet.
Klasik olan.
Aynen. Sizinle de tanıştığıma memnun oldum. Duydum sizi Emel Hanım ama hiç fırsat olmadı.
Evet. Biz aslında benim eşim Bursalı. Biz Bursa'ya çok sık gelip gidiyoruz.
Öyle mi? Öyle mi? Ne güzel.
Evet, eşim Bursalı.
Alper Bey'i hep görüyoruz, konuşuyoruz da Alper Bey'le geliyor sağ olsun.
Ya çok güzel oldu. Biz bunu bir daha yapalım. Ve katılım çok oldu. Normalde webinarlarda bu kadar katılım olmuyor. Hele
Evet.
bir de İngilizce dersen hiç katılmıyorlar diyelim. Bir de çıkan da olmadı. Hani böyle İngilizce duyup da şey de olmadı. Gerçekten
Evet, baştan sona kadar
herkes izledi. Gittikçe de sayı arttı. Güzel,
Evet.
çok güzeldi. Emeğinize sağlık.
Teşekkürler.
Tamam.
Oldu hocam. İyi akşamlar.
İyi akşamlar.
Merhaba. Hello.
Her şey mi? Var mı?
Çıkalım. Niye çıkamıyoruz?